Mr. President, I rise today to talk about health reform. And I'd like to start by telling you the story of a little boy named Isaac. From the day his parents brought him home as a newborn to Isanti, Minnesota, he was sick all the time. He had everything from the flu to bronchitis to ear infections, but unlike most little boys, Isaac never seemed to get better. His parents, as any parents would, did everything they could to help him. They brought him to every medical specialist they could think of, but no one could figure out what was wrong. Finally, Isaac was diagnosed with a rare disease called common variable immunodeficiency. This means that every 2 weeks, a nurse has to visit his home to give him the medicine that lets his body fight off germs. Without this medicine, Isaac's body can't fight off even a common cold. The home visits and IV medications that Isaac needs are expensive, but Isaac's parents had health insurance, so Isaac was able to have a normal childhood. Today, Isaac is a 19-year-old college student in Minnesota with dreams of becoming an English teacher. Here's a picture of him. He's the one on the right. That's Isaac. Because of the toll his illness takes, his family decided that Isaac should go to school part-time. Unfortunately, before the health reform law was passed, young adults over 18 years of age generally had to be in school full-time to stay on their parents' health insurance. And if Isaac hadn't been able to stay on his parents' health plan, he would have been in a tremendous bind. His disease is the definition of a pre-existing condition, and it would have been nearly impossible for him to find affordable individual coverage. But because of the health reform law that we passed last year, Isaac can now stay on his parents' health insurance, regardless of his school status, through his 26th birthday. He and his family were able to make the choices that made sense for their family without having to worry about Isaac's health insurance. And in fact, in a few years, when he turns 26, a key provision of health reform will have kicked in, and insurers will no longer be able to discriminate against him or any American because of a pre-existing condition. Isaac's parents may not be doctors, but they are experts when it comes to the needs of their family. And they know the truth about what the health reform law has already done for their family. And just like Isaac's family, Minnesotans may not know every word of the health reform law, but they are experts on what they need for their own families. Let me tell you about another Minnesota family that learned about the benefits of the new law. Maya, who you can see right here, is one of 3 million Americans with epilepsy. She had her first seizure when she was just 3 years old. Modern medicine has not yet been able to find a way to stop her seizures, but by taking 5 medications per day, she can control them. Recently, Maya's father was laid off and the family lost his health insurance. Maya's parents suddenly had to confront the possibility they would no longer be able to give Maya the medications she needs to fight her daily seizures. Without insurance, Maya's medications cost more than $1,500 a month, which would quickly bankrupt her family. Losing a job is stressful enough. But before the health reform law, Maya's parents would have had to worry about buying health insurance on the individual market, and because of Maya's pre-existing condition, that would have been almost impossible. Fortunately, the health reform law has banned insurance companies from discriminating against children with pre-existing conditions. And so her family was able to get onto another insurance plan without being denied. The diagnosis of a chronic illness can happen to anyone at any time. Often, like for Maya, it doesn't happen because of a lifestyle choice or genetic predisposition. It just happens. Maya was 3 years old when she was diagnosed. And paying for essential medications and healthcare services that help control chronic conditions like Maya's can easily put a hard-working family into bankruptcy. Medical costs are the cause, wholly or in part, of 62% of all bankruptcies in this country. That will change dramatically because of this law. Americans will no longer be discriminated against because of pre-existing conditions, and insurance companies can no longer impose lifetime limits on the dollar amount of care that they will provide. This is an enormous, almost incalculable benefit to Americans and their peace of mind. The truth is that Congress listened to people across this country. People like Isaac and Maya and their families, by allowing kids to stay on their parents' insurance longer. We listened by ending insurance companies' discrimination against women and people with pre-existing conditions. And we listened when the American people said that lifetime caps on insurance benefits were forcing millions of chronically ill Americans into bankruptcy. The people of Minnesota believe, as I do, that a family that works hard shouldn't be financially ruined if their kid gets sick. When I was campaigning, I heard this again and again from families across Minnesota, and I was listening. The people asked this Congress to find a way to make health care affordable for everyone, and we did. Now, the insurance companies and their political allies want you to believe that the only way to keep your premiums low is to cap the amount of benefits that you can receive in your lifetime, but this is just not true. In the health reform law, we worked hard to slow the growth of health care costs without abandoning the over 1/3 of American adults who struggle with chronic disease. The truth is, last year we passed a bill that will save the lives of countless Americans and will save billions of taxpayer dollars. That's right. According to the Congressional Budget Office, the referee that everyone here in Congress agrees to abide by, whether we like their decisions or not. According to CBO, the law saves us money, lots of money. In fact, hundreds of billions of dollars. Now, let me say a word about CBO to my colleagues. You can't use CBO's numbers when you like them and then totally dismiss them when you don't. CBO is directed to provide unbiased and independent analysis and estimates. Their analysts use the best research available for their scores and projections. In fact, they established an independent review panel of expert healthcare economists to advise them in their analysis of the health reform bill. Not only are the experts' names published on CBO's website, but their analysis of the law is public as well. CBO is nothing if not transparent and independent. Now, of late, we have heard members of this body frankly mischaracterize the process by which CBO does its job. They've said that CBO must rely solely on information and data fed to them by the majority. Garbage in, garbage out. That's a quote. Garbage in, garbage out is how they described it here on the floor. This could not be further from the truth. Frankly, I find some of my colleagues' new refrain about CBO disturbing and not a little disingenuous. One of the things that we tried to do in health reform was to take steps that would lower the costs of health care in this country. Take, for example, our efforts to reduce administrative costs by streamlining the way healthcare providers bill for their services. This is something I push for because we recently did it in Minnesota, and it saved $56 million in the first year alone. Now, nationwide, that should translate to around $25 to $30 billion over 10 years. And actually, the health reform law went well beyond what Minnesota did. So it's not surprising that outside experts like those at the Commonwealth Fund, RAND, and others estimate much greater savings from administrative simplification in the range of $162 to $187 billion over 10 years. So, when CBO made their analysis and estimated savings of less than $20 billion for the same period, I admit I was a little miffed. But I didn't attack CBO. I accepted their result. And we're all duty-bound to do the same. Even when CBO projects that the law as a whole will save over $100 billion in the first 10 years and over $1 trillion in the following decade. Now, we accomplished these savings with a number of common-sense solutions, like stopping insurance companies from padding their bank accounts with profits from sky-high premiums. As part of health reform, we require insurance companies to spend at least 80 to 85% of the money they receive in premiums on actual health care services. It's 85% for large group plans, 80% for small group or individual plans. This is a provision that I championed. The other 15 or 20% can be spent on administrative costs, on marketing, on CEO bonuses, and on profits. This provision kicked in this year, and it will hold insurance companies accountable for costs and help contain health care costs in this country. We also changed the way that health care is paid for in this country by starting to reward quality of care, not quantity, value, not volume, in Medicare. I was proud to fight alongside Senator Cantwell and Senator Klobuchar for the inclusion of a value-based payment modifier in the Medicare reimbursement formulas. Now, perhaps the most common sense thing we did to control costs was making sure that everyone has access to preventive care. In Minnesota alone, the law will give millions of people access to free preventive care. Women will be able to get mammograms without any out-of-pocket costs. And starting this year, seniors now have access to free preventive checkups each year without costs. This is completely contrary to claims I've heard on this floor. You know, a large part of the cuts in Medicare spending, not cuts in benefits, a large part of the cuts in Medicare spending are cuts to wasteful subsidies for insurance companies. Now, one of my colleagues has taken to the floor and said this law will, quote, cut the funding so people on Medicare Advantage who like it, who like the preventive medicine activities of it, are going to lose those opportunities, unquote. He goes on to say about the seniors in his state, quote, once they lose this, they are going to lose preventive services. This is simply not the case. Thanks to this law, everyone on Medicare will enjoy preventive services, so their doctors will catch problems early. Seniors know that an ounce of prevention is worth a pound of cure, and that's why preventive services under this law will be covered for everyone without copays, contrary to what my friend on the other side says. You know, this is what has bothered me about this debate: the constant stream of misinformation. This same colleague on the floor said this about the law, quote, "It doesn't solve America's doctor shortage, doesn't even address it," unquote. Doesn't even address it. Now, no one is claiming that this bill solves the doctor shortages that we have in this country, but doesn't even address it. There is a whole title in the law that lays out a number of programs, over 96 pages, that make significant investments in the healthcare workforce, especially in primary care physicians. Most notably, it created a public health workforce loan repayment program that helps recruit and place more doctors, nurses, and other healthcare providers in medically underserved areas. That's important for states like Minnesota. And this was an integral and vital part of health reform. Anyone who states that this law did nothing to address the shortfall of healthcare providers just has not read the law. We've seen misrepresentations from opponents right from the beginning with the so-called death panels, and it continues to this day. Medicare recipients are going to be denied preventive care. The law doesn't even address the doctor shortage. CBO is just fed garbage by the majority and isn't allowed to look at anything else. In November, one of my colleagues cited an oft discredited assertion originally made by some Republicans on the House Ways and Means Committee. According to one analysis, my colleague said here on the floor, the Internal Revenue Service will need to hire 16,000 new IRS employees to enforce the individual mandate. Well, that's just not true. Some new IRS employees will be needed, but nowhere near that number. And overwhelmingly, they will be there to administer the tax breaks to small businesses for insuring their employees. What my colleague said on the floor is simply not true, and no matter how many times it is repeated, it will not become true. There was a colloquy from June of last year between two of my colleagues. The first senator says that doctors are leaving Medicare, and that's true. Some are. He says, the president of the state of New York Medical Society is not taking new Medicare patients. Then the second senator says, as well as the Mayo Clinic. And the first senator answers by responding, Mayo Clinic said we cannot afford to keep our doors open if we are taking Medicare patients. And then he moved on. So is it true that the Mayo Clinic really isn't taking new Medicare patients? Well, I called up Mayo, which happens to be in my state, to find out. And they gave me the facts. You know what? Of course it's not true. The Mayo Clinic has 3,700 staff physicians and scientists and treats 526,000 patients a year. There's one Mayo Clinic, Arizona family practice, one that isn't accepting Medicare payment for primary care services. Yet this is just part of a time-limited trial for this one clinic with just 5 physicians on staff. That's it. But this becomes, to quote my colleague, Mayo Clinic said we cannot afford to keep our doors open if we are taking Medicare patients. Well, the Mayo Clinic is the largest private employer in Minnesota. And believe me, their doors are still open to new Medicare patients. Medicare reimbursements are low, and Mayo has actually lost hundreds of millions of dollars in the last year alone because of it. And Mayo, like the rest of Minnesota, delivers higher value care at a lower cost than clinics and hospitals in other states. That's because Mayo provides coordinated, integrated care. Mayo's outstanding doctors are on salary, so they aren't incentivized to order and perform unnecessary and expensive tests and procedures. And Mayo's outcomes are second to none. And yet Mayo is punished for all of this by receiving lower reimbursements for Medicare. That's why I pushed with other colleagues for the value index. That's why we need to pass the so-called doc fix that cancels scheduled cuts to reimbursement rates every year. And by the way, the doc fix is something that we would have to do whether or not we passed health reform. Yet, despite all of this, the Mayo Clinic is keeping its doors open to new Medicare patients and should be commended for that. It shouldn't be accused of closing its doors to Medicare patients when it is not. Mayo shouldn't be used as a political football. Look, I could go on and on and on with these, but the fact of the matter is that if we want to have a debate about the health care law, we really should make an effort to present a case based on what's really in the law and what is really happening on the ground. This is what the American people want from us. Health care is far too important to the lives of our constituents for us to indulge in gross distortions, obvious omissions, and absurd extrapolations. The American people don't want that. Not for something this important. Not for something that affects their lives and the lives of people that they love. The American people, Mr. President, have given us all tremendous responsibilities. Minnesotans worry that the floor could drop out from under them at any time and that no one will be there to catch them when it does. They worry about their families. They worry about their friends and their community. We owe it to them to be honest with them and with each other, to be responsible, to be real. So let's get real. Now, as I mentioned in my story about Maya, the little girl with epilepsy, thanks to the new law, she can get health care because insurance companies now cannot discriminate against children with pre-existing conditions. In 2014, insurance companies will not be able to discriminate against any American child or adult with a pre-existing condition. And in 2014, that's when the mandate kicks in. Now, here's what one of my colleagues says about the provision in the law that now allows little 3-year-old Maya to be treated for her epilepsy. Quote, "The health care law allows parents to wait until their child is sick before buying a policy. When only sick people buy health insurance, premiums have to go up. As the rate increases, more people drop their coverage." Unquote. Well, that's why we have the mandate. The mandate is crucial if you want to do things like getting rid of denials for pre-existing conditions. And by the way, the mandate has been a Republican idea. The mandate was a Republican idea in their 1993 health reform bill. And let me tell you why. See, health care law is like a 3-legged stool. The first leg is accessibility. Everyone needs to be able to buy insurance so that when they get sick or hurt, they can access the care they need.
Mr. President.
So we banned.
Mr. President.
Will the senator yield?
Mr. President, I do apologize to the senator from Minnesota. I wanted to ask if I could send a modification to my amendment to the desk. Mr. President, I send a modification to my own amendment, my second-degree amendment to the desk.
The amendment is so modified.
Thank you, Mr. President, and I thank the senator from Minnesota.
You're very welcome.
Senator from Texas.
Would you not interrupt his speech and the record with my interruption?
Without objection.
Thank you.
Okay, well, I'd like to thank the senator for that courtesy and allowing me to get a drink, because I really, honestly, thank you. As I was saying, the health care law is like a three-legged stool. The first leg is accessibility. Everyone needs to be able to buy insurance so that when they get sick or hurt, they can access the care they need. So we banned insurance companies from discriminating against people with pre-existing conditions. Banning discrimination against people with pre-existing conditions is something that both parties say that they like. In fact, in its Pledge to America, the document that Republicans ran on in 2010, in the healthcare section, there is the heading, quote, "Ensure access for patients with pre-existing conditions." And it goes on to say that they will ban insurance companies from discriminating against patients with pre-existing conditions. That's their pledge. And that makes sense. You see, over 1/3 of all Americans have a pre-existing conditions. Actually, at the Minnesota State Fair, a woman in her early 70s came up to me and said, "You know, at my age, everything's pre-existing." Now, she was enrolled in Medicare, but Maya wasn't. And Maya's family shouldn't have to choose between going without the care that they need and going into bankruptcy. But as my colleague indicated, there is a risk that this provision would incentivize people to buy health insurance only after they get sick or hurt, which would drive everyone's costs up. So because of this, the second leg of the stool is personal responsibility. We have an individual mandate to make sure that people don't wait until they get sick to go get insurance, and to create a pool of insured people that is large enough to support all the folks who had previously been unable to get insurance. If everyone has health insurance, everyone will be able to access care when they need it. And by the way, the rest of us who have insurance will benefit, because today we're paying almost $1,000 a year per family in premiums to cover the emergency room visits of people who don't have insurance. But for some people, buying health insurance is just too expensive. So the third leg of the stool is affordability. We provide assistance to those families who need to buy health coverage on a sliding scale all the way up to 400% of the federal poverty level. So that's our three-legged stool: accessibility, accountability, affordability. We don't discriminate against people with pre-existing conditions, and so we have a mandate. So people don't just wait until they get sick or hurt to get insurance. And because you're mandated to get health insurance or pay a fine, we make sure everyone can afford it. Three-legged stool. And if you take any leg out, the stool collapses. You know, when I've explained it this way to Minnesotans, I find that they are no longer confused about the law. They know how important it is to have access to health insurance regardless of pre-existing conditions, to take responsibility for themselves and their families, and to have health care that they can afford. But some of my colleagues have been advocating that we cut off a leg or even two legs of the stool. But a two-legged stool collapses. And a one-legged stool, well, maybe at best it's a spinning plate. The arguments for repealing this law remind me of an old Shalom Aleichem story that I heard from my dad when I was growing up. Now, you don't hear much about Shalom Aleichem on the Senate floor, so I'm going to tell you a little bit about him. Shalom Aleichem was a beloved 20th century writer who wrote stories, novels, and plays in Yiddish. The Broadway hit Fiddler on the Roof was based on his writings. Now, in the story that my dad told me, a man borrows a plate from his neighbor. The man takes the plate home and drops it accidentally and breaks it. He sneaks back into his neighbor's house and replaces the plate, the broken plate. Neighbor comes home, finds the broken plate, and goes over to the guy's house. And he says, "What's the deal with the plate, the broken plate?" And the guy says, "Well, in the first place, I didn't borrow it. In the second place, when I borrowed it, it was already broken. And in the third place, when I returned it, it was in one piece." That's what I'm hearing from the opponents of this bill who want to repeal it. In the first place, we are for banning discrimination against people with pre-existing conditions. In the second place, we are against banning discrimination against people with pre-existing existing conditions because then no one would buy health insurance until they get sick or hurt, and that would drive up the cost of health insurance. And in the third place, we want to repeal the law because it makes healthy people buy health insurance or pay a fine in order to keep the cost of health insurance down. This is what I hear every day from the opponents of the health reform bill. The opponents of the bill, my colleagues on the other side, pledge that they won't discriminate against people with pre-existing conditions. But then they say they don't want to ban discrimination because they don't want to encourage people to wait until they're sick to buy insurance. But they don't want to mandate that people take personal responsibility by buying health insurance. And then they stand up and say that the American people are, to quote a colleague, sick of spin. Well, I would like my colleagues to stand up and admit that they broke the plate. We owe it to the people who elected us to this body to tell the truth about health reform law. We owe it to the millions of Americans whose lives will be changed by the provisions in this law, like Isaac, like Maya. And already we have seen the positive changes that such reform can bring. Look no further than the state of Massachusetts, which in 2006 passed its own set of health reforms. And its reforms were similar to what the Affordable Care Act is doing at the national level, including an individual mandate, subsidies, and even an exchange. The result has been a huge increase in the number of people with health insurance, including an increase in the number of people who get insurance through their jobs. Let me put that another way. Because of the state's health care reform, more people have health insurance from their employer. At the same time, Massachusetts has seen a decrease in the rate at which premiums are going up when compared to the rest of the country. As the rest of the country saw insurance premiums go up by 6.1%, from 2007 to 2008, premiums in Massachusetts only went up by 5.0%. That's more than 20% less than the rest of the country just a year after its health care reform was passed. That's not a silver bullet, but it's certainly a step in the right direction for small business owners and for families. And more than 98% of Massachusetts residents have health insurance, as compared to less than 84% nationally. I think the effects of health reform in that state are pretty clear. More people are insured. Premiums aren't going up as quickly as around the country. And more people are getting their insurance through their employer. The health reform law is not a silver bullet, but hopefully a series of steps in the right direction. And you have to question the claims of my colleagues who say that health reform will cause the sky to fall, because there's good evidence to believe that they're crying wolf. Yes, you heard me right, Chicken Little is crying wolf. Just ask the people of Massachusetts. In a recent poll, nearly 80% of Massachusetts residents said they wanted to keep the health reform law that they passed in 2006. Nearly 80%. Now here's another one. I've heard a colleague urging the repeal of this law say, and I quote, "We need to allow small businesses to join together, to pool together in order to offer affordable health insurance to their workers, get better deals with insurance costs." He said this as if it wasn't in the law. In fact, he has said these exact words repeatedly here on the floor each time, creating the clear implication that the health reform law does not allow small businesses to pool together to get better deals on health insurance. But in fact, this is exactly why we passed a health reform law that includes health insurance exchanges. We owe it to the American people to tell the truth about this. And the truth is that health reform created state insurance exchanges so that health care will be available to the 43 million workers employed by the 5.9 million small businesses around the country. The exchanges will also make affordable health insurance available to the 22 million self-employed Americans. Within these exchanges, insurance companies will compete and offer multiple plans so that everyone can choose the plan that works best for their family. And in all cases, they'll be negotiated on behalf of the combined pools of all participating businesses with fewer than 100 employees in the state. This will give unprecedented negotiating power and competition that will directly benefit workers at small businesses, and not just the workers, but especially the owners of those businesses, who, by the way, are already receiving tax credits to help them pay for their employees' insurance. The fact is, a majority of Americans are supportive of what this law is trying to do, and they don't want to go back to the broken system that we had before it passed. They know that it is crucial that American families have health care when they need it. And they know that this law will give millions more American families access to this care while creating jobs and saving money. The truth is that the people have spoken on health care. Unfortunately, some of my colleagues have not been listening. When you're talking about legislation, it's easy to fall into the trap of either promising the world or warning that it will cause the sky to fall. Neither is right. The reality is far more complex than that. The truth is that the Affordable Care Act will change millions of lives, but won't fix a very broken healthcare system overnight. It was the result of a lot of negotiation and compromise. The truth is, the American people want us to move forward and implement this law. They know that some parts of it will work better than other parts. They want us to change what doesn't work and build on what does. They know that provisions like the ban on discrimination against children with pre-existing conditions are already helping families across this country, including Isaac, including Maya. I challenge my colleagues to talk to families with children like Isaac and Maya. Americans are experts on the health care needs of their own families. I've talked to families all over Minnesota, and they tell me they need accessible health care, they need affordable health care, and they want to take the personal responsibility to insure their families. But the truth is they need our help. They need us to make sure that the stool keeps standing. Thank you, Mr. President, and I yield the floor